State or county? We'll talk to a health leader on whether having the state take over mental health funding would improve access. Plus, we'll examine the staffing records inside the Anamosa State Penitentiary following those attacks that killed 2 workers. And in the Insider's Quick Six, what Iowa should do without mountains and oceans.
From your local election headquarters, this is the Insiders with Dave Price.
Iowa Senate Republicans think the state should take over funding for the mental health system instead of having counties do it through property taxes. We'll see if the House Republicans agree with this, but a mental health leader wonders if a combination could be best.
I think that some local investment and engagement is important, but I don't think it should be, I actually think it should be like the K-12 education system, which is a mix. There's local control, but there's also some state accountability because there's state funding. And I think that that's the way the mental health system should be. Right now, I agree with Senator Dawson, who's the author and sponsor of the floor manager of this bill, that the mental health property tax levy has caused huge divisions and tension and conflict within regions, between counties, between regions. It's the source of a lot of conflict and disagreement, and it has kept us from moving forward in our mental health goals. So I do think the state has to be involved in some way with some money. We don't advocate for complete state funding, but that seems to be the preference of some of our legislators.
So some of the criticism I've heard, though, is that while it could simplify it, if you will, if the state takes over all of this and takes it away from the property tax funding formula that we have right now, the challenge could be that maybe they fully fund this year, but it could be a different makeup of legislators in a couple years, and then they don't do it, and then you're not looking at a stable funding stream. Does that concern you or not?
It does. When the governor had her plan last year, that's why we really wanted to maintain the property tax levy and also allow for flexibility. So if the state does not come through with their end of the bargain, that counties could conceivably, again, levy that property tax to make up the difference. She was open to that, but of course that bill didn't advance. I think that I'll just say the Iowa Farm Bureau is, I know, very much in favor of doing away with the property tax levy. This is one of their, and has been, one of their big priorities. So I would count on them if the state does not fulfill its obligation to fund mental health, that they would be by our side insisting that the state do it so that it doesn't go back on property taxes.
Now, we're talking about just this Senate side. The House has not taken it up in this way. So how does this get resolved? There would seem to be rather substantial differences in the way the 2 chambers are looking at this, right?
There are definitely substantial differences. We've heard Speaker Grassley say he's not inclined to even take it up. That his concern is the Senate bill has the state funding it in its entirety, but a lot of the decision making would remain at the local level, which Speaker Grassley doesn't seem too excited about. He talked about it in terms of writing a blank check, that if the state's going to provide the money, the state should have more authority and more oversight. And that's certainly an argument that is valid and that we would encourage more discussion about. But I think that because this is a Farm Bureau priority, there's going to be a lot of pressure on the House to consider it.
Okay, so let's look back at this Senate proposal here. Will this in the end put more dollars toward this effort, and will services expand and get better for the people who need them or not? Or does it just simplify how the math works?
It does initially put more dollars toward it. And the thing we like about it is that it is a per capita funding formula, meaning that the counties with the most people will get the most money. And that's not happening right now necessarily because of all these limits on the property tax levy. Polk County, for example, has been frozen at the same amount for the last 8 years. And they've just been in a world of hurt and scrambling every year to try to make it work. And it shouldn't be that way. So there is a built-in growth factor, and it is per capita. Those are two things that we really like, because right now the property tax levy is frozen at 1996 levels, and I don't see that changing anytime soon. So the counties and the regions are stuck with what they have.
When you have been on this show the last several years, you have talked, though, about while Polk County may have its own unique set of circumstances here, once you get out into some of these smaller areas, though, how do the services get to those people? Now, you've talked about the benefits of telehealth services, and perhaps that's one good thing that's come out of COVID-19 is that there is more focus, it seems, on using technology to reach people for their needs remotely like this. But this discussion, this Senate idea here, is that addressing any of this to bring services to where people are? Will that expand anything?
Well, I do think telehealth is key. We've seen it expand tremendously over the last year out of necessity because of the pandemic. And it has been especially important for behavioral health because we have a critical lack of providers across the state. The providers tend to be in urban areas. So rather than making people drive for 2 or 3 hours to go to an appointment in person with their provider, we think telehealth is a pretty good solution. We need to make sure that our private and health insurers continue to pay for it equitably. So that's another priority of ours. I think that, Senator Dawson made reference to this in the debate on the bill. He said this may cause regions to realign, which really what we know that means probably is consolidate and combine. I'm not sure we need 14 regions, which is what we have now. Maybe regions do need to look at consolidating and having at least one major service area in each region to make this work. And probably if this is adopted, you will see that happen.
Complicated for sure. Up next, why Iowa businesses say they can't find the workers they need.